Postpartum depression is a serious condition that can have devastating consequences when it goes unrecognized or untreated. It affects 1 in 8 women who give birth, yet it is just now getting the attention it deserves. One woman described it this way, quotes, "I thought I'd be overjoyed when my daughter was born, but instead I felt completely overwhelmed. This baby was a stranger to me. I didn't know what to do with her. I didn't feel at all joyful. I attributed feelings of doom to simple fatigue and figured that they would eventually go away, but they didn't. In fact, they got worse." Depression, of course, is common in the United States. Some 15 to 25% of Americans suffer from the disease, and it's twice as common in women as it is in men. It has its peak prevalence in those age 18 to 44, and hormone fluctuations increase one's vulnerability. All of this said, it's not surprising that childbearing women are at risk. It's just surprising how it's been kept a secret. Depression following birth forms a continuum of conditions ranging from mild to life-threatening. The least serious has been termed the baby blues and affects approximately 70% of all new mothers. Symptoms include crying, sadness, irritability, anxiety, and irregular sleeping and eating patterns, peaking 3 to 5 days after delivery and disappearing generally within 2 weeks. Having the baby blues is often described as an emotional letdown that does not impair functioning. This contrasts with true postpartum depression that takes hold within days of delivery and can last for up to a year. This condition can seriously impair the mother and delay cognitive and social development of the child. When poorly managed, it's also associated with high rates of divorce in the year following the baby's birth. While the baby blues clear fairly rapidly, postpartum depression lingers on or worsens. Immediate evaluation is required if a woman experiences 5 of the following symptoms: depressed mood, marked disinterest in activities, appetite disturbance, sleep disturbance, physical agitation, extreme fatigue, a sense of worthlessness, decreased concentration, or suicidal thoughts. Treatment with psychotherapy and/or antidepressant medications is very effective. Now, I should note that a small subgroup of women who give birth experience postpartum psychosis. It occurs in 1 or 2 of every 1,000 births. Within the first few weeks after delivery, these mothers suffer from delusions and hallucinations, including in some cases voices instructing them to harm or kill their babies. This condition is a medical emergency that requires hospitalization. With such obvious pain, discomfort, and symptoms that affect more than 500,000 U.S. women each year, it's reasonable to ask how postpartum depression has remained so well hidden. One answer is that, for all practical purposes, women are not screened for it or properly made aware of it. They don't know that if they've had depression before, there's a 30% chance they'll suffer from postpartum depression. And if they've had postpartum depression with one child, there's a 50% chance that they'll have it with the next. That number increases to 70% if they've had postpartum psychosis. Beyond this, the first and often only follow-up visit with the obstetrician is at 6 weeks, somewhat late for this condition. The 10-question, 5-minute Edinburgh Postnatal Depression Scale that is 95% effective in picking up postpartum depression is infrequently used to screen new moms. And the well baby visits with the pediatrician focus on the baby, not the mother. Postpartum depression can happen to anyone. If your caregiver hasn't alerted you to the possibility of depression and it happens to you, you might quite naturally try to brush it off. You might assume that your feelings are temporary, part of a normal adjustment period. You might try to live up to the good mother label. You might keep your thoughts and fears to yourself to avoid someone thinking you're crazy and possibly taking your baby away. Remember, most women come into motherhood with an armload of myths, including All moms and all babies are perfect. All dads will chip in. I can do this, and my life will be basically the same. What should you do? Talk about it, get help, and you'll get better. For caregivers, screen early and often and involve family members. For family, take action, get help, listen, support. For Health Commentary, I'm Mike McGee.